Hi, I'm Dr. Laura Rifka-Stern. I'm a family physician. I work at Sage Neuroscience Center for the last 4 years. Here at Sage, we help people detox from multiple medications, drugs, and alcohol. The Detox Clinic is used to help people initially if they are dependent on drugs and having withdrawal symptoms that make them feel uncomfortable and make it unsafe for them to stop their medications or alcohol on their own. We help people detox from alcohol, opiates, including pain pills, heroin, and fentanyl. Other drugs that we help people detox from are cocaine, methamphetamines, benzodiazepines including Xanax, Valium, clonazepam, and others. We can also help people who want to stop using marijuana or THC. We have helped people who are addicted to bath salts and kratom. The dangers of detoxing at home depend on the drug that they are abusing or using too much of. Alcohol is particularly dangerous. People can have seizures or severe hallucinations or very high blood pressure and can actually pass away from alcohol withdrawals. Therefore, it's important to be in a monitored situation, whether it's in the hospital or in an outpatient setting like Sage. We can give medications to help manage the withdrawal symptoms so that somebody can safely get off the alcohol that they're using. Sometimes opiates and or methamphetamines can be dangerous and benzodiazepines like Xanax can be dangerous to detox at home. Xanax in particular as well, people can have seizures and so should be in a medically supervised setting. Other drugs, people can go through detox on their own, and it is okay to come in even if you've stopped using whatever drug or alcohol that you want to stop using and still get some support from us. The other part that we can do is to help with cravings. So there are medications that can take the edge off the cravings so that you are not as likely to relapse. When you call the clinic to start the detox process, they will find out what drug or alcohol you are using and have you instructed to come in usually in mild withdrawals. If you don't feel like you can manage coming in withdrawals, then come in and we can give you some medications to help you manage the withdrawals before you stop using. But we're hoping when you come in, you're ready to stop using, and we will get that process going with medication support. So you'll have an appointment to see a provider in the detox clinic. Then we will also have you do a substance use assessment, and this is with one of the counselors who will get some more in-depth history about your addictions or dependencies, and then discuss the other wraparound services that Sage offers. There are medications that can help with cravings. Other times it's counseling, intensive outpatient program, and other meditation and relaxation techniques. The other issue is lots of people use substances to self-medicate because they're struggling with anxiety, depression, post-traumatic stress, or other traumas and stressors. And so we want to help you manage those issues that you haven't been able to that you've been self-medicating. People should consider detox when they're ready to stop abusing the substances that they've been taking. If you think you might have a problem, it's okay to call and come in and have a discussion with someone. Again, the actual detox process initially is to help get through withdrawals from the medication that you're taking. That might make you go back to taking the medication because you can't manage the withdrawals on your own. However, after people have gotten off of the substance they've been abusing, there are medications that we can use to help with cravings. So even if you've stopped using, you can still come in through detox to see if there are medications that can help with cravings and other medications that can help you manage anxiety, depression, post-traumatic stress syndrome, and other trauma. Sage is a very special place. It offers wraparound services for alcohol and drug addiction. Besides having the acute detox that we offer here, we offer counseling, we offer the intensive outpatient program. We also offer psychiatric services for depression, anxiety, PTSD, bipolar disorder, schizophrenia. Many people who use substances are self-medicating because they have these other problems. So we can help manage all of those problems. We also offer primary care here at Sage. People might have been neglecting other parts of their health, and they can get wraparound services with primary care services as well as their behavioral health issues. Addiction is a complex chronic brain disease. Nobody wants to be an addict, and nobody ever thinks they're gonna have problems with addiction when they start using alcohol and or start using drugs. Many people were prescribed opiates by their physicians, and then the person finds out that they're physically dependent on them. Addiction actually changes how your brain works. It's a chronic disease like having diabetes. Nobody wants to have diabetes, but once you have diabetes, we want to help you manage your disease. That might take medications, it might take counseling, it might take exercise, meditation. All those things can help you manage your chronic disease.